Yeah, I think they were very interesting highlights because I am part of the liquid biopsy committee for the International Association of the Lung Cancer. So we wrote the guidelines in 2018. That this is published in the Journal of Thoracic Oncology. And then with the International Association of Liquid Biopsies, we go our guidelines in 2020. Basically, historically, the standard of care is tissue NGS, next generation sequencing. And when we wrote these guidelines on the two societies, we said, okay, but now there is a new technology, liquid biopsy. We do the NGS, the next generation sequencing, in the DNA in the blood instead of the DNA in the tissue. And this is as good as tissue and considered to use as a complement. 20% of the time, 25% of the time, there is not enough tissue. Now we have a tool that can complement the 20 or 25% so everybody can be tested. But that was in 2018, 2020. Nowadays, we have technology and we have studies that show that liquid biopsy is not enough that is as good as tissue. Maybe can replace the tissue. For example, my team presented in the Congress, we were one of the 8 best abstract presentations. So they gave us an oral presentation in the Congress. And basically what we presented in the Congress is that we have 170 patients with lung cancer that we have we treated and we do liquid and tissue at the same time at the 74. That's the best treatment for that patient based on the liquid. And the tissue is only needed for 26% of the time. Why? Because the liquid biopsy result arrives in 8 and 9 days, while the tissue takes 3 or 4 weeks. So in 8 or 9 days, based on the data provided by the liquid biopsy, 74% of our lung cancer patients get a treatment decision. And that's real world data. So that's why what we're pushing in this Congress with my presentation or other presentations is that you can use liquid first, okay, not all the time, but many times. And the advantage for the patient is that the waiting time is only 8 to 9 days to know what is the best treatment for him, instead to wait 3 or 4 weeks. Because the disadvantage of the tissue is always the shipping. You need to send the tissue somewhere else to be tested. Not everybody is lucky to have one of these machines. So that's why this was one of the most, and in the Congress, and we spent several sessions talking about this, that when we're going to be ready to use liquid first or recommend liquid first, because as I mentioned before, in the current guidelines that we have not updated yet, liquid is still a complement of the tissue.